Your kidneys may be getting damaged by habits you do every single day. Not rare habits, not strange habits, not habits that look dangerous from the outside. I am talking about normal daily routines. The salt in your food, the sugar in your drinks, the painkillers you take without thinking, the urine you hold because you are busy, the water you forget to drink, the blood pressure you ignore because you feel fine, the blood sugar you do not check because symptoms have not appeared yet, the sleep you sacrifice, the smoking you keep promising to quit, the alcohol you call just a little, the energy drinks, sodas, processed foods, and long hours of sitting that slowly turn into a lifestyle. And the dangerous part is this. Your kidneys usually do not warn you loudly at the beginning. They whisper. A little swelling around the ankles. A puffy face in the morning. Urine that looks darker than usual. Foamy urine that keeps coming back. Blood pressure that slowly rises. Muscle cramps that seem random. Tiredness that sleep does not fix. Brain fog that makes you feel older than you are. Back or side discomfort that you keep blaming on age. And most people explain these signs away. They say, maybe I just need more water. Maybe I slept badly. Maybe I ate too much salt yesterday. Maybe it is just stress. Maybe it is just getting older. But kidney damage can build quietly. And by the time many people realize their kidneys are struggling, the damage may already be serious. I am Dr. Adrian, and today I want to walk you through 18 daily habits that can quietly damage your kidneys. Some of these habits will sound obvious, some will surprise you. And habit number 1 may shock many people, because millions of adults use it every morning to feel alive, focused, and productive, without realizing that too much of it may put extra stress on the kidneys, heart, sleep, and blood pressure. But before we begin, I want to be very clear. This video is not meant to scare you, it is meant to wake you up. Your kidneys are not weak, they are hardworking. They filter your blood, they remove waste, they balance fluid, they help control blood pressure, they regulate minerals like sodium, potassium, calcium, and phosphorus. They help manage acid levels. They help activate vitamin D. They help support red blood cell production. So when your kidneys are damaged, it does not affect only urination. It can affect your energy, your blood pressure, your swelling, your heart, your bones, your brain, your sleep, your strength, and your long-term independence. That is why these daily habits matter, because your kidneys are working for you every minute. The question is, are your habits helping them, or are your habits forcing them to work under pressure? Stay with me until the end, because after habit number 1, I will give you the warning signs you should never ignore, and a simple 30-day kidney protection plan you can start using without panic. Now let us begin. Habit number 18 is excessive salt intake. This is one of the most common kidney-damaging habits because salt is everywhere. It is in chips, instant noodles, canned soups, pickles, frozen meals, restaurant food, fast food, processed meat, crackers, sauces, seasoning packets, and many foods that do not even taste extremely salty. Salt is not evil. Your body needs sodium, but too much sodium can raise blood pressure in many people, and high blood pressure is one of the biggest enemies of your kidneys. Your kidneys are full of tiny blood vessels. When blood pressure stays high, those tiny vessels are forced to handle more pressure than they were designed for. Over time, that pressure can damage the filtering units inside the kidneys. This creates a dangerous cycle. High blood pressure damages the kidneys. Damaged kidneys can make blood pressure harder to control. Then the higher blood pressure damages the kidneys even more. That is why salt is not just a taste issue. It is a kidney pressure issue. The mistake many people make is thinking, I do not add salt at the table, so I am fine. But most sodium often comes from packaged and restaurant foods, not the salt shaker. So the solution is not only to hide the salt shaker, the solution is to read labels. Look for sodium. Choose lower sodium options. Use garlic, onion, lemon, vinegar, herbs, black pepper, ginger, and spices for flavor. Stop depending on salty packets to make food taste good. And give your taste buds time. When you reduce salt, food may taste flat at first. But after a few weeks, your taste buds adapt. Then foods you once loved may start tasting too salty. Your kidneys will appreciate that change. Habit number 17 is excessive sugar intake. Sugar is not only a weight problem, it can become a kidney problem. When you drink sweet tea, soda, sweet coffee, energy drinks, fruit punch, packaged juice, or eat sweets every day, your blood sugar can rise repeatedly. Over time, high blood sugar can damage small blood vessels, and your kidneys are full of small blood vessels. That is why diabetes is one of the biggest causes of kidney disease. Now, many people think, I am not diabetic, so sugar is not my problem. But prediabetes and insulin resistance can develop silently. Weight gain can raise blood pressure. High blood pressure can damage kidneys. So sugar can harm the kidneys indirectly through several pathways. Blood sugar, weight, blood pressure, inflammation, blood vessel damage. The biggest daily mistake is drinking sugar. Liquid sugar is especially easy to overconsume. You can drink hundreds of calories in minutes and still not feel full. So if you want one powerful kidney-protecting change, start with drinks. Replace soda with water. Replace sweet tea with unsweetened tea. Replace sweetened coffee with plain or lightly flavored coffee. Replace juice with whole fruit in controlled portions if it fits your blood sugar plan. And if you have diabetes, ask your doctor about kidney screening. Do not wait for symptoms. Kidney damage from blood sugar can begin quietly. Habit number 16 is eating too much meat, especially processed and heavy red meat. Protein is necessary. Your body needs protein to maintain muscle, repair tissue, support immunity, and stay strong. But too much animal protein, especially from processed meats and large portions of red meat, can increase the waste burden your kidneys must handle. Your kidneys help clear waste products created when protein is broken down. For people with healthy kidneys, reasonable protein intake may be fine, but if kidney function is reduced, excessive protein can become a problem. Processed meats are even worse because they often bring sodium, preservatives, saturated fat, and phosphorus additives. Think about bacon, sausage, hot dogs, ham, deli meat, canned meat, fast food meat. These are not just protein foods, they are sodium and additive packages. The mistake is thinking, I need protein, so more meat is better. No, the right question is, how much protein is right for my body and kidney status? If you already have chronic kidney disease, your protein target depends on your stage and whether you are on dialysis. Some people with CKD may need to limit protein, some people on dialysis may need more. That is why guessing is dangerous. A smarter approach is to reduce processed meats, choose cleaner protein sources, and ask your doctor or renal dietitian how much protein is right for you. Your kidneys do not need extreme protein, they need balanced protein. Habit number 15 is excessive strenuous exercise without recovery or hydration. Exercise is good. Movement supports blood pressure, blood sugar, circulation, weight, mood, and kidney health. But extreme exercise without preparation, especially in heat, dehydration, or while using certain medications, can create problems. One serious risk is a condition called rhabdomyolysis. This happens when muscle tissue breaks down and releases substances into the bloodstream that can overwhelm and injure the kidneys. It can happen after extreme workouts, heat stress, dehydration, trauma, or overexertion. Warning signs can include severe muscle pain, extreme weakness, swelling, and dark cola-colored urine. That is not normal soreness. That is a medical warning sign. The mistake is thinking, if exercise is good, brutal exercise must be better. No. For kidney protection, consistency is better than punishment. If you are over 50, returning to exercise, working in heat, or taking medications, build slowly. Drink appropriately. Take rest days. Do not combine dehydration, intense exercise, alcohol, and painkillers. That combination can be hard on the body. Exercise should make you stronger over time, not break you down in one dangerous session. Habit number 14 is overusing painkillers. This habit is extremely common. Back pain, knee pain, headache, shoulder pain, arthritis, tooth pain. People take over-the-counter pain medicine without thinking, but some common painkillers, especially NSAIDs like ibuprofen and naproxen, can affect kidney function, especially when used often, at high doses, during dehydration, or by people with kidney disease, heart disease, high blood pressure, or certain medications. These medicines can reduce blood flow to the kidneys in some situations. For occasional use in a healthy person, they may be acceptable. But frequent use without medical guidance can be risky. The dangerous thought is, it is over-the-counter, so it must be harmless. That is not true. Over-the-counter does not mean risk-free. If you need painkillers often, talk to your doctor. Ask what is safest for your kidneys. Ask whether your kidney function should be tested. Ask whether physical therapy, weight loss, stretching, heat, safer pain strategies, or other treatments may help. Do not use painkillers as a daily habit without knowing your kidney status. Your kidneys deserve that caution. Habit number 13 is ignoring the urge to urinate. Many people do this. They are busy. They are driving. They are working. They are in a meeting. They are watching something. They do not want to get up at night, so they hold urine again and again. Doing this occasionally may not destroy your kidneys, but making it a habit can create problems. When urine sits too long in the bladder, bacteria may have more time to grow. That can increase the risk of urinary tract infections in some people, and if infection travels upward, it can reach the kidneys. A kidney infection can become serious. Holding urine too long can also worsen bladder discomfort and urinary problems in some people. The solution is simple. Listen to your body. Do not make ignoring urination a lifestyle. If you need to go, go. If you urinate very frequently, have urgency, burning, weak stream, blood in urine, pain, fever, or back pain, get checked. Do not feel embarrassed. Your urinary system is part of your health. Habit number 12 is ignoring urinary tract infections. This is one of the most dangerous habits because people often try to manage urinary symptoms at home for too long. They drink cranberry juice. They take old antibiotics. They search online. They wait. They hope it passes. But urinary tract infections can become serious, especially in older adults, men, people with diabetes, kidney stones, weakened immune systems, or kidney disease. Symptoms may include burning during urination, frequent urination, urgency, cloudy urine, blood in urine, pelvic pain, fever, chills, or back pain. If infection reaches the kidneys, symptoms can become more severe. Fever, chills, side or back pain, nausea, vomiting, weakness. This is not something to ignore. The mistake is thinking it is just a urine infection. A simple bladder infection can often be treated, but a kidney infection can become dangerous if ignored. So if you have urinary symptoms, especially with fever, back pain, or feeling very unwell, seek medical care. Your kidneys are too important to gamble with. Habit number 11 is ignoring high blood pressure. This is one of the most silent kidney destroyers. High blood pressure often causes no symptoms. You may feel normal. You may walk, talk, work, eat, and sleep without any obvious warning. But inside the body, high pressure can damage blood vessels, and your kidneys are full of delicate blood vessels. When these vessels are damaged, filtering becomes harder. Over time, kidney function can decline. Many people say, "My pressure is only a little high." But your kidneys feel that pressure every day. The solution is not complicated, but it requires consistency. Check your blood pressure, know your numbers, reduce sodium, move your body, manage weight, sleep better, reduce alcohol, take medication if prescribed. Do not stop medication because you feel fine. Feeling fine does not mean the pressure is not causing damage. Ask your doctor what your blood pressure target should be, and ask whether your kidneys are being monitored. Blood pressure control is kidney protection. Habit number 10 is poorly managed diabetes. High blood sugar can damage the filtering units in your kidneys. This can lead to diabetic kidney disease. And the scary part is that early kidney damage from diabetes may not cause symptoms. You may not feel pain. You may not feel sick. You may not notice urine changes. That is why testing is so important. If you have diabetes, ask about your eGFR. Ask about urine albumin. Ask about A1C. Ask whether your blood pressure is at target. Ask whether your medications protect your kidneys. Managing diabetes is not only about avoiding sugar spikes. It is about protecting your eyes, nerves, heart, blood vessels, and kidneys. The dangerous habit is saying, "My sugar is a little high, but I feel okay." Your kidneys may not agree. Control blood sugar early. Do not wait for symptoms. Habit number 9 is skipping regular exercise. Exercise is one of the most underrated kidney-protecting habits, not because exercise directly washes the kidneys, but because it helps the systems that protect the kidneys. Exercise supports blood pressure. It supports blood sugar, it supports weight control, it supports circulation, it supports sleep, it supports mood, it helps reduce the risk factors that damage kidneys over time. The mistake people make is thinking exercise must be intense to matter. It does not. A regular walk can help. Light strength training can help. Cycling can help. Swimming can help. Dancing can help. Gardening can help. The best exercise is the one you can repeat safely. If you are inactive, start small. 10 minutes after meals, 15 minutes in the morning, a short walk with a friend, standing more often. Do not wait until you feel motivated. Build the habit first. Your motivation often follows your movement. Habit number 8 is drinking soda. Soda is a kidney problem from multiple angles. Regular soda can bring a heavy sugar load. That can contribute to weight gain, diabetes risk, blood sugar problems, and metabolic stress. Cola drinks may also contain phosphoric acid, and phosphorus is a special concern for people with kidney disease. Dark sodas are especially worth discussing with your doctor or dietitian if you have CKD. Diet soda removes sugar, but that does not mean it should become your main drink. Many people use diet soda to avoid water completely. That is not ideal. The habit to stop is making soda a daily default. Replace it gradually. Start by cutting the amount in half. Switch 1 soda per day to water, then unsweetened tea, then lemon water, then sparkling water without sugar if it works for you. Your taste buds can change. Your cravings can change. But you have to give your body a chance. Habit number 7 is eating ultra-processed foods every day. This is different from simply eating salt. Ultra-processed foods are industrial foods designed to be convenient, tasty, and easy to overeat. They may contain high sodium, added sugars, refined carbohydrates, unhealthy fats, phosphorus additives, preservatives, and very little fiber. They are often low in the nutrients your body actually needs and high in the ingredients that drive blood pressure, weight gain, and metabolic problems. Your kidneys do not only suffer from one bad meal, they suffer from a pattern. If breakfast is packaged, lunch is fast food, dinner is frozen, and snacks come from bags and boxes, your kidneys may be living under daily pressure. The solution is not to become perfect. Start by replacing one ultra-processed food with one whole food. Replace chips with fruit or unsalted options. Replace instant noodles with homemade soup. Replace processed meat with fresh protein. Replace soda with water. Replace packaged sweets with berries or a better snack. One replacement per day becomes 7 per week. That is how change starts. Habit number 6 is sitting for too long. This one seems harmless. You sit for work. You sit in the car. You sit during meals. You sit watching TV. You sit scrolling your phone. Hours pass. Days pass. Years pass. Long sitting is linked with poor circulation, weight gain, insulin resistance, higher blood pressure, and metabolic problems. All of these can affect kidney risk. Even if you exercise sometimes, sitting all day still creates a problem. Your body was designed to move. The solution is not complicated. Stand up every 30 to 60 minutes. Walk while taking calls. Keep water away from your desk so you have to stand up to refill it. Take stairs when safe. Walk after meals. Stretch your legs. Do a few bodyweight movements if your body allows. Do not let your kidneys live in a body that barely moves. Circulation matters. Movement supports circulation. Habit number 5 is not drinking enough water. We talked about hydration earlier, but it deserves its own place because so many people are underhydrated. Water helps your kidneys remove waste. It helps dilute urine. It can reduce the risk of certain stones in people who are prone to stones. It supports blood volume and circulation. But many people drink coffee, tea, soda, alcohol, and energy drinks, then wonder why their urine is dark. Now, water needs are personal. Some people need more. Some people with heart failure, advanced kidney disease, dialysis, swelling, or fluid restriction may need less. So do not force excessive water if your doctor has restricted fluids. But if you are healthy and often dehydrated, start earlier. Drink water when you wake up. Carry a bottle. Use urine color as a rough clue. Pale yellow is often a good sign. Very dark urine may suggest dehydration, though foods, vitamins, and medications can also change color. If urine is bloody, painful, very foamy, or unusual, get checked. Do not assume water will fix everything. Habit number 4 is smoking. Smoking is not only a lung problem, it is a blood vessel problem, and kidney health depends on blood vessels. Smoking can damage the lining of blood vessels, increase oxidative stress, raise blood pressure, worsen circulation, and increase cardiovascular risk. All of that matters for kidneys. If you already have kidney disease, smoking can make the situation worse. The mistake is thinking, I have smoked for years, so quitting now will not matter. That is false. Quitting can still help your heart, blood vessels, lungs, blood pressure, and future. If quitting feels hard, that does not mean you are weak. Nicotine addiction is real. Get help. Ask about nicotine replacement, medication, counseling, support programs, and practical quitting plans. Your kidneys do not need another cigarette. They need better blood flow. Habit number 3 is not getting enough sleep. Sleep is not just rest. It can become harder to control. Blood sugar can worsen. Cravings can increase. Weight can rise. Stress hormones can stay elevated. Inflammation can increase. All of these can affect kidney risk. Poor sleep also increases the risk of unhealthy decisions. More caffeine, more sugar, less exercise, more stress eating, less motivation. If you snore loudly, wake up gasping, feel exhausted during the day, or have difficult to control blood pressure, ask your doctor about sleep apnea. Sleep apnea can contribute to blood pressure and cardiovascular problems. Protect your sleep like it matters, because it does. Habit number 2 is excessive alcohol consumption. Alcohol can harm kidney health indirectly and sometimes directly. It can raise blood pressure. It can dehydrate the body. It can affect sleep. It can affect blood sugar. It can interact with medications. It can damage the liver, and liver disease can put extra stress on the kidneys. Heavy drinking can also increase the risk of accidents, poor food choices, and medication mistakes. The dangerous thought is, I only drink to relax. But if alcohol is raising your blood pressure, ruining sleep, causing dehydration, or becoming a daily need, it is not relaxing your body, it is stressing it. Be honest about your intake. If you drink, keep it moderate. If your doctor has told you to avoid alcohol because of kidney disease, liver disease, medications, or other health problems, listen. And if cutting down feels impossible, ask for help. That is strength, not weakness. Now we come to habit number 1, excessive caffeine consumption. This one surprises people because coffee and tea can have benefits for some people when used moderately. So let me be precise. Moderate caffeine may be fine for many adults. But excessive caffeine can become a problem, especially through energy drinks, strong coffee all day, caffeine pills, pre-workout powders, and late-day caffeine. Too much caffeine can raise heart rate. It can worsen anxiety. It can disturb sleep. It can irritate the bladder. It can affect blood pressure in some people. It can contribute to dehydration if it replaces water. And if it damages your sleep, it indirectly affects blood pressure, blood sugar, stress hormones, and kidney risk. Energy drinks are especially concerning because they often combine caffeine with sugar or stimulants. Some people drink them on an empty stomach, before workouts, during long workdays, or when already dehydrated. That is not kidney smart. The habit to stop is using caffeine to cover up a body that is exhausted. If you need caffeine all day just to function, something is wrong. Maybe sleep is poor, maybe stress is high, maybe blood sugar is unstable. Maybe you are dehydrated. Maybe you are overworked. Caffeine is not a cure for that. Use caffeine wisely. Keep it earlier in the day. Drink water. Avoid energy drink abuse. Protect sleep. And if caffeine causes palpitations, anxiety, high blood pressure, reflux, or insomnia, reduce it and talk to your doctor. Now we have covered the 18 habits, but I want to give you something even more important. Warning signs you should not ignore. Swelling in your feet, ankles, hands, or face. Foamy urine that keeps coming back. Blood in the urine. Urine that is very dark without a clear reason. Pain or burning when you urinate. Frequent urination, especially if it suddenly changes. Urinating much less than usual. Back or side pain with fever. Muscle cramps that are frequent or severe. Constant fatigue, brain fog, loss of appetite, nausea, shortness of breath with swelling, blood pressure that is repeatedly high. These signs do not always mean kidney disease, but they deserve attention. Do not self-diagnose. Do not panic. Do not ignore them. Get evaluated. Now, here is the simple 30-day kidney protection plan. For the first 7 days, focus on awareness. Check your blood pressure. Look at your urine. Read labels for sodium. Notice how often you use painkillers. Count sugary drinks. Notice how much you sit. Do not judge yourself. Just observe. For days 8 to 14, remove one kidney stressing habit. Cut soda. Reduce salt. Stop holding urine. Reduce processed meat. Replace one ultra-processed meal. Choose one. For days 15 to 21, add one kidney-supporting habit. Walk after meals. Drink water earlier. Improve bedtime. Eat more whole foods. Track blood pressure. Ask your doctor about kidney tests. For days 22 to 30, make it measurable. Ask for your eGFR. Ask for urine albumin. Ask about blood pressure goals. Ask about blood sugar if you have diabetes. Ask whether your medications are kidney safe. Ask how often you should check your kidneys. This is how you stop guessing. Now I want to leave you with this. Kidney damage often begins quietly, but kidney protection can begin quietly too. One less soda, one less salty meal, one safer pain plan, one blood pressure check, one walk after dinner, one better night of sleep, one doctor visit, one lab test, one honest decision. You do not have to change all 18 habits tomorrow, but you do need to start, because your kidneys are working for you right now, silently, faithfully, every minute. They are filtering your blood, balancing your fluid, protecting your chemistry, helping keep you alive, so protect them before they have to shout. If this video helped you understand the habits that can damage your kidneys, share it with someone over 50 who needs to hear it. Especially someone with high blood pressure, diabetes, swelling, dark urine, frequent painkiller use, heavy soda intake, or a family history of kidney disease. They may not need fear. They may need one clear explanation at the right time. This video is for educational and informational purposes only. It is not personal medical advice and does not replace your doctor, nephrologist, urologist, dietitian, pharmacist, or healthcare team. Always speak with a qualified healthcare professional before changing medication, stopping medication, changing fluid intake, changing diet, using supplements, or treating urinary symptoms, especially if you have chronic kidney disease, diabetes, high blood pressure, heart disease, kidney stones, swelling, fluid restriction, dialysis, or if you take prescription medication. I am Dr. Adrian. Take care of your kidneys, protect your energy, protect your future. And remember this, the habits that damage your kidneys may be quiet, but the decision to protect them can start today.